Namaste. Today I am back again from a place called Condado, which is a suburb of San Juan, the capital of Puerto Rico. The small little island that we are in right now because of COVID-19, we're stuck here, as you already know. Condado is a beautiful place. I mean, there's like within maybe 200 meters from here, there's a gorgeous rocky beach that I'll show you. It's just beautiful. And early morning, people are getting a wonderful sight. Unfortunately, the place that we are in, we are not getting that kind of a sight. Now let's get to the real meat of the matter here, which is diabetes. I'm sure you know a lot about diabetes, and I'm sure some of the information that I'll be giving you is going to be something that you already know. But there are a lot of hows, why diabetes happens is something that people don't talk about. They just talk about how diabetes happens. And that's what I'm going to concentrate on. It's going to be a very short video, but I'd like for you to understand what diabetes is all about. So believe it or not, there are 4.5 types of diabetes. The first one is called diabetes type 1, which is the condition when a human being cannot produce insulin, which is required for using the glucose that your body has created by taking all the foods and breaking it down to glucose. That's the first type, where people with this condition really don't have the ability to produce insulin. The second type, which is what I'll be concentrating on today, is called type 2 diabetes. And type 2 diabetes can be normal, and then there is a type 2 gestational, which is, during pregnancy, a lot of women get this type of diabetes because of the enormous amount of pressure exerted on their pancreas. Type 3 diabetes, believe it or not, is a condition that happens with Alzheimer's patients when they cannot metabolize sugar and they get into a condition like diabetes because of their Alzheimer's, not because of anything else. And then the fourth one is very rare, which happens in people that are really, really old, which is, like over 90. And we really don't have to worry or talk about that, which is when the cells are so aged that they really cannot take in the glucose. So that's the fourth type of diabetes. Again, like I said, we'll talk about type 2, which is the main one. Okay, I have a prop just like Dr. Jenny had, a carrot. So what's happening right now when I'm eating a carrot, right? What's happening is there is fructose and sucrose coming out of the carrot and my body is absorbing it. But let's look at what happens when bunny rabbit is eating the carrot. So here's our beloved bunny, or Bugs Bunny, or whatever, some rabbit that's eating a carrot. And let's see what happens when he eats the carrot. Now remember, bunnies' metabolism and our metabolism is pretty much the same. So whatever happens to the bunny happens to us. So here is the carrot he ate, and when he eats it, it breaks down, of course, into many parts, minerals, vitamins, fiber, but in addition it breaks down into a couple of sugars. And there are two types of sugars mainly. One are those little purple colored ones we call glucose. Commonly we call sugar, but it's really glucose that we can absorb. And the second are the yellow ones that are called fructose, which our body cannot absorb. So what happens is we'll end up absorbing using the purple colored ones we call glucose. Let's take another example of bread. What happens in a slice of bread? So you eat a piece of bread. I don't know if a bunny eats it or not, but we eat a piece of bread, and it all forms into a complex of molecules that are really glucose but all lumped together. We call starch. So starch really is this with a bunch of fiber, and we digest it further and we create like little strands of glucose, and those strands are again further broken down into individual glucose molecules. So when we have these individual glucose molecules, our cells can actually absorb these into our system. Now, let's take a look at the normal cell and go to the microscopic level and see what happens when this glucose arrives at a normal cell junction. So let me explain what this looks like. What this is. It's a normal cell with these little red dots. Those are gates, if you will, through which glucose can enter the cells. So glucose cannot just simply pass through the membrane without any hindrance. There are these little gates. The little brown dots you see, we call them organelles. These are, imagine them like organs within the cells. And then middle part, the central blue part, is the brain or the nucleus of the cell, if you remember your elementary biology. So let's take a look at one of the parts. Let's concentrate on one of these gates through which glucose can come in. So let's expand that further. So there's our gate, and there's the cell wall. The bottom part of the cell wall is the part inside of the cell, and the top part is the outside. And I forgot to mention that these little yellow squiggly lines are what we call, fancy term for it is intracellular lipid, but you guys call it fat. So basically it's fat within cells, and keep in mind that every cell has some amount of fat to some extent or the other. And now here's our glucose, the little purple hexagons that came in, trying to enter the cell, but it's not going to let it enter because the gate is closed. So remember, if you recall, the way glucose can enter is through the use of insulin. So in response to glucose in our bloodstream, our pancreas sends insulin. Insulin goes in, and so here is our little insulin, 2-3 insulin molecules, and they go in, and what they do is they're like a lock and key. They attach themselves to the cell wall, and when they do, like that, the cell wall says, oh, there's some, insulin is attacked, so that means there's glucose outside. So what it does is this insulin has these little helpers inside the cell. Imagine these helpers coming in and saying, oh, insulin is here, let's open up the gates. So they go out and help opening up the gates, and they attach, let's say, I mean, this is kind of a simplification, but they kind of attach to the imagine them attaching to the gates and helping open those gates up. So when the gates open, guess what happens? You can have glucose come flooding in. Once the glucose is inside, the cell can use it for generating energy, which is exactly the way all cells in every living organism works. We need glucose as a source of energy. Now let's take a look at a diabetic cell. So diabetic cell again looks very, very similar to a normal cell, except if you notice there are a few more squiggly lines in there. So there's more fat strands, if you will, in there. Now let's take a look at the little gate, and here's the cell wall, here's the little gate, red gate, and then the little fat strands, right? And we have glucose coming in, and when glucose comes in, obviously insulin is released, and this is type 2 diabetes, right? So insulin is released just like before, and just like before, insulin attaches to the membrane, and when it does, we have the little insulin helpers, if you will, try to get to the gate to open it. But guess what? This is where they land up. They just land up in the middle, and most of them cannot help open those gates up. If they cannot open the gates up, we have a condition known as type 2 diabetes, where there's glucose outside, but the cell does not have any glucose and is starving. So cell starvation, excess glucose in the bloodstream, excess insulin in the bloodstream, and most importantly, fat in the cells is a typical thing for type 2 diabetes. I hope this explains it. So in all these animations, I've shown you how fat is not allowing insulin to do its job, right? If you still don't believe it, because it's all at a molecular level, why don't I give you a visible, very obvious example? So imagine a person injecting themselves with insulin every day, and here is what it looks like. Okay? So you inject in one place and there's fat all around it. It's because, think of it as if insulin loves to hold on to fat around it. Insulin loves fat. It wants fat to be around it. And if that is the case, what happens is it's very difficult for somebody, once they're on insulin, to lose weight, because they cannot get rid of the fat, because the fat always stays away, in the cells, and then it never comes out. So that's another clear-cut evidence that insulin and fat have this relationship where wherever there is insulin, fat just sticks around, does not want to come out. So Like I said, we have alluded to this earlier. Dr. Jenny will go into greater detail about how to cure this, how to reverse this phenomena. Rather than take medications or insulin, there are ways in which we can actually reverse this whole phenomena so that you can get rid of fat, you can get rid of insulin dependence, you can get rid of your diabetic condition, high sugar, etc. in a safe and healthy and long-lasting manner that you will be very happy to do. Once it's gone, you'll be very happy to see the results. So that's where I'd like to end this talk here. If you have any suggestions, comments, please make sure that you go to our video down below. There is a comment section. You can just type your comments in and we'll be happy to respond as soon as possible. As soon as we see the results, as soon as we see your responses, we do respond back. If you have any other topics, please let us know. And while you're at it, when you're already on YouTube, make sure you like, subscribe, and hit the. So once you hit the subscribe button, you'll see a little bell icon come up. Click on the bell icon to alert yourself, so any new videos will come directly to your inbox, and you don't have to keep looking for our new videos. Okay, so that's where I end. Thank you so much. Bye.